Hi, I'm Dr. Urvisha, pediatric dentist based in Mumbai, and today we are going to discuss everything you as parents need to know about MIH, Molar Incisor Hypomineralization, or more commonly called as Chalky teeth. So I will be talking about what is MIH, why does it happen, how common is it, how to spot if your child has MIH, what are the difficulties children face when they are suffering from MIH, is it a preventable condition, are there any home measures or home remedies, toothbrushes and toothpastes, and professional dental treatment options available for MIH. Let's begin. Now, MIH is a defect in the mineralization of tooth enamel. See, our tooth has three layers. The outermost is called as enamel, which is hard and strong. The middle layer is the dentine, which is responsible for the sensitivity of the teeth. And the innermost layer is the pulp or the nerve of the tooth. Now, this enamel is the outermost protective layer. It protects the tooth from bacteria, from breakage, from sensitivity, from decay, and it is able to do that because it has lots of mineral deposition in it. Now, how is this enamel formed? So, the cells of enamel called as ameloblasts form enamel in two stages. The first stage is secretion stage in which they secrete proteins and forming a matrix. And the second stage is called as maturation stage in which these proteins are removed and lots of mineral deposition is done and the matrix is crystallized, making it hard and resistant to acids. Now, when there is a defect in the deposition of minerals, this enamel becomes porous. See, you have to understand that the thickness of the enamel is normal. There is no change in thickness. But because there is less deposition through the entire layer of enamel, this enamel becomes softer, more prone to decay, highly sensitive and easily breakable. Now, when there is less deposition of minerals in the enamel, it is called as hypomineralization. Since it affects your molars and incisors, it is called as molar incisor hypomineralization. And because these lesions usually appear chalky white, that is why these teeth are called chalky teeth. Currently, our science is not able to pinpoint the exact cause of MIH, but it is found to be more frequent in children who have had illnesses or high fever when they were very young, that is from birth to 3 years of age. Even women in their last trimester of pregnancy who have taken antibiotics, it has been found that their children have had MIH. Also, children with low birth weight or suspected calcium deficiency or even respiratory illnesses have been found to have MIH. Hereditary also plays a major role in MIH prevalence. Surprisingly, this condition is very common. Almost 1 in 6 children are affected by it. Usually, it affects your back molars, be it milk or permanent, as well as your upper front teeth called the incisors. For your front teeth, you can lift the lip and check. In mild cases, the defective enamel usually appears extra white, but the surface is otherwise normal and intact. There is no breakdown of tooth structure. The child may have some complaint about the aesthetics, otherwise he is asymptomatic. In moderate cases, the lesion typically has a creamy yellow appearance and the surface breakdown has just started. There may be some decay. The child may complain of sensitivity and pain, as well as aesthetically it doesn't look very nice. In severe cases, the lesion has a typical mottled brown color in appearance and pothole formation has started, sometimes even before the tooth has finished erupting completely. There is decay at an advanced stage and the child complains of extreme sensitivity and pain and refusal to brush the surface, and looks-wise they look very ugly. See, the normal enamel is a barrier to bacteria. But once this enamel is porous, the bacteria can travel very quickly from the outer surface to the inner dentine and pulp. So in spite of your child brushing twice daily, these teeth are prone to decay, faster spread of cavities, and may necessitate root canals in the blink of an eye. The second problem is when the enamel covering the dentine is destroyed, the dentinal tubules get activated and cause sensitivity. So even mildly warm or cold food can cause instant pain to your child, and the child refuses to eat those food. He refuses to brush the area because it's paining, and this refusal to brush causes more decay and more pain, and a vicious cycle starts. Now, since we are not able to pinpoint the exact cause of this condition, we are not able to prevent its appearance. But what we can prevent is its progress. Early detection is the key to prevent mild cases from becoming moderate and moderate cases to becoming severe. So, always lift the lip and check. Contact your pediatric dentist if you see chalky teeth. See, there are two methods of combating MIH related problems at home. One is diet modification. Cut down the refined sugars. Reduce the frequency of exposure to sweet and acidic food. No soda, no carbonated drinks. Increase in alkaline foods. Increase the intake of dairy products such as milk and cheese. Increase the water intake. The second and the most critical method of combating MIH related problems is to keep those teeth clean. So ideally brush twice or three times a day with a fluoridated toothpaste which has at least 1000 ppm of fluoride. Then interdental flossing is a must, tongue cleaning is a must, and I would personally recommend to use a fluoride mouthwash as well. Now, toothbrushes, first thing to take care is use soft bristled toothbrushes. No electronic, no digital, no sonic toothbrushes, especially if the child is experiencing high sensitivity. And you use gentler brushing technique but effective technique so that the tooth gets clean but there is no further damage to the already softened enamel. So for children with MIH, they should be using toothpaste which not only have fluoride, but they are also capable of depositing minerals like calcium in the tooth to make up for the deficiency. So when you're buying a toothpaste, in the ingredient list, look for keywords such as fluoro or phosphate or calcium phosphate or TCP or CPP, ACP, recaldent, etc. Okay, my personal recommendations for the toothpaste would be 3M Clean Growth Tooth Cream and MI Paste Plus by GC. Both these toothpastes are able to deposit minerals such as calcium and fluoride and phosphates, and they work wonderfully well together. You can use one in the morning and the other in the evening. Only thing to take care is for children below 3 years of age, use a rice grain size, and for older children, you can use a pea size. So in addition to the toothpaste, I would recommend use of tooth mousse. This contains CPP, ACP, which are milk-derived proteins, and they help to make up for the lost minerals in the tooth. So how do you apply it is you take a pea-size amount after brushing and apply it on the teeth. Massage it with your finger or with the tongue for at least 3 minutes. Use a timer if you need to. After 3 minutes, spit the excess out, but do not rinse or gargle, and take no food or water for at least 30 minutes. You can use this for about 4 times a day maximum, but usually overnight application is sufficient in most cases. And it's very recommended in young children since it comes in a variety of flavors from mint to strawberry to vanilla. Children are quite happy accepting it. Now, it is very important to start enhanced protection as soon as MIH is diagnosed. For molars, in mild cases where it is a defective patch and the surface is not broken, we have two forms of protection. One is fluoride varnish and the second is dental sealant. The fluoride varnish provides a direct deposition of fluoride in the affected enamel, making it acid resistant. And what a sealant does is it forms a barrier over the fissures of the tooth, which are usually the starting point of cavity formation. But it is important to note, in many cases of MIH, the sealants do not stick to the affected tooth as well as they do to normal teeth. So it is very important for regular dental checkups to make sure that the sealant is still intact in place or it needs to be repaired. Now, moderately affected teeth are already potholed to some extent, leading to risk of further dental decay and breakdown. So a dental filling is recommended to stall these problems, and in combination with ongoing home care program can often lead to long-lasting reasonable outcome. In fillings, silver fillings are a complete no. Go for glass ionomer fillings or resin modified glass ionomer restorations. and once the lesion has stabilized, then the choice would be composite restorations. In severe cases of MIH, when there is extensive tooth destruction, I would recommend, in addition to the fillings, a full coverage steel crown. What the crown does is protect the tooth from further damage, manage the sensitivity, and most importantly, restore the dimensions of the tooth so the child is able to chew the food efficiently once again. In rare cases, when tooth destruction is extreme and the prognosis is very poor, one may consider removing of the tooth altogether. For front incisors, we have three main options. One, microabrasion and dental bleaching. Here, the enamel is abraded and polished to remove the surface irregularities, and then we bleach the tooth to mask the chalkiness. 2. Resin infiltration. Now, this is a very novel technology in which we perfuse the porous enamel with resin by capillary action. So what we are doing is we are creating a barrier inside the lesion as well, and not just on the surface. And third is composite veneers. So in severe cases, when we remove the defective tooth structure and we restore it to the original dimensions with the help of composite. Once the child is older, the jaw growth has stopped, we replace these composite veneers with porcelain veneers, which are much more sturdy and stain resistant. Well, I hope you found this video on MIH informational and it helped clear any queries or doubts or questions you may have had when you've seen white spots on your teeth or on your child's teeth. Please do leave your feedback in the comments below. If you have any queries, you can leave it in the comments and I will try my best to answer it. Like and subscribe for more informational videos. Thank you.